And welcome back. In a health alert, Le Bonheur Children's Hospital recently established its very first division of child psychology and behavioral health. As the hospital deepens its commitment to psychological well-being, its new chief, Dr. Donald Don Bearden, is helping shape the future of pediatric mental health in Memphis and beyond. He joins us now to talk more about his new role and what it means for children right here at home. Doctor, welcome to 3 at 3 and welcome to Memphis, Tennessee.
Thanks.
Glad to have you here.
Great to be here. I appreciate it.
After 9 years of serving in the facility in Atlanta, Georgia, you come to Memphis. What did you see in our city? What did you see in Le Bonheur?
I saw an opportunity. So I was there 9 years, and I'm very grateful for my time at Children's Healthcare of Atlanta and Emory University, and I learned so much. Coming here, I saw an opportunity to take what I had learned, all the skills that I had gained, and use them where they could really be put to good use, so that I could make a difference and have more of a direct effect on patient mental health care within the hospital.
When it comes to your vision, though, for behavioral mental health, what do you see there?
There's so much opportunity. We have many amazing specialties within the hospital. We have child life, social work, psychology, psychiatry, chaplain services, many wonderful specialties. And bringing those specialties together and creating a voice and letting the Memphis tri-state area know that we're here, and we're here to help their kiddos and to help the whole child, not just the physical, but also the mental part as well, the emotional piece.
As you already well know, Memphis has its challenges. It's a very poor community. Is that part of the challenge also, and how do we elevate that?
It is just access, right? So it's about access to care, and when you have a lower or more under-resourced families, then it becomes more difficult for them to access those services. So as part of my initiative, I'm working with the team to improve patients' access, ability to access the care at Le Bonheur, and working with community mental health providers to build a network so that while patients are being served at the hospital, after they leave, making sure that they don't fall through the cracks and miss out on getting mental health care outside of the hospital.
One of the many fascinating things about you is when it comes to diversity, especially the diversity of this country, the growing Latino Hispanic population nationwide and right here in Memphis, you also speak Spanish. How important is all of that in kind of bridging that gap that we were talking about?
Yeah, so thank you for asking about that. It's one of the most meaningful things that I'll do in my career. And I learned Spanish specifically for that reason. While I was in Atlanta, I saw we had a growing Hispanic community. We didn't have any providers in the department that spoke Spanish, so I took that initiative with the support of the hospital. And so I've already started here. I've hit the ground running, and I think probably I've been here 5 months, and I want to say 90% of my patients have been bilingual Spanish speaking. So it's been fantastic to be able to continue to use that skill for what it was meant to.
I do want to also ask you, in the few seconds we have left, when it comes to the brain, its function, how it behaves, what's always fascinated you about this?
Well, the brain is like the universe. The more that we know, the less we know, and there's so much yet to understand. And I think that for me, understanding how the environment affects the brain and vice versa, and the relationship between behaviors and the brain, I mean, that's what drew me to neuropsychology, and I'm passionate about it, and there's always more to learn.
Yeah. What do you want Memphians to know about you and the hospital that we have here, Le Bonheur?
So I would say that I'm here to help the kids of Memphis to improve their mental health care and to make sure that they receive the services they need when they come to see us at the hospital. And that's what I'm here to do, and that is my intention, and I intend to follow through with it. So thank you.
Doctor, honored to have you in Memphis, Tennessee. Glad this is your home.
My pleasure.
Let's do this on a regular basis.
I'd love that.
Whenever you have time.
Absolutely.
All right, short break. Tyler, what do you have?